Coronavirus.
Covid-19.
Of Covid-19.
Coronavirus.
It's a plague on our country like nobody's ever seen.
COVID-19, the virus that changed the world's trajectory, brought long-lasting impacts on health and wellness. Massive blows to businesses, upsetting the economy. School closures and distant learning toppled a well-entrenched educational order. 2025 marks the 5-year anniversary of this epidemic. Now out from under the shadow of an immediate contagion, it's time to consider the medium and long-term impacts the COVID virus has had on society. This documentary examines the effects of COVID-19 and what it had on physical, mental health, business owners, and schools. To gain context and perspective, and in order to do this, we start in the year 2020.
Centers for Disease Control and Prevention works 24/7 to protect the American people from dangerous health threats.
2020, the new year and the new decade, was off to a rocky start. According to the CDC, on January 10th was when the world first heard the infamous phrase COVID-19, referring to the disease causing the outbreak in Wuhan, China. Then on January 19th, worldwide, 282 laboratory-confirmed cases of the coronavirus were reported in 4 countries. China had 278 cases, Thailand had 2 cases, and Japan and the Republic of Korea reported 1. Then on January 20th, the CDC reported the first laboratory-confirmed case of COVID-19 in the United States. January 23rd, Wuhan, China, a city of 11 million people, were placed under lockdown due to the coronavirus outbreak. February 10th, worldwide deaths from the virus reached 1,013. February 23rd, Italy became a global COVID-19 hotspot, so the country went under lockdown. And in the month of March, things only became worse for the world, as more than 118,000 cases in 114 countries and 4,291 deaths were reported. The World Health Organization declared COVID-19 a pandemic.
By declaring it a pandemic, the World Health Organization is not saying all of a sudden it's now more deadly than it was yesterday. That's not what it's about. It really is about how quickly it's spreading.
On March 13th,
we will be suspending all travel from Europe to the United States for the next 30 days.
A nationwide travel ban on non-U.S. citizens traveling from 26 European countries due to COVID-19. And on March 15th, states like New York City began implementing shutdowns where schools closed and essential businesses like gas stations and grocery stores were what remained open, leading to years' worth of turmoil and destruction. The normal bustling streets of Manhattan suddenly resembled a ghost town from a post-apocalyptic feature film. Quarantine became an American watchword. A key strategy to impede disease spread and reduce risk became the lockdown, an order for people, community, or country to stay where they were. Maintaining health and wellness during lockdown was key to beating this deadly virus. Part 2 of this documentary looks into the toll COVID-19 took on physical and mental health and its impacts 5 years later. What were we up against in order to fight it? This is what COVID-19 looks like under a scanning electronic microscope. Some say it's aesthetically pleasing. Other experts see the devil in the virus detail. Let's look into the functionality of COVID.
The spike is very important because it's the key that the virus uses to unlock entry into the human cell. Without the spike, the virus can't be infectious. We know what the spike looks like from experiments, as you can see in this 3D printed model, where the virus surface would be on the bottom. At the top, in these 3 different colors, are these small finger-like shapes that the virus actually can open and close, like shown in this 3D printed model, with an open structure. This opening and closing motion happens while the virus is searching for a molecule on the surface of the human cell, and then it can interact with it like an address telling it the right place to go. Once it finds the right address, then the spike undergoes a large change and attaches itself to the human cell and eventually is let inside. Blocking that interaction is very important to preventing infection. Your immune system eventually develops antibodies that will bind to the spike and stop this motion, but in the meantime, you may get very sick.
The virus sure looks scary. Now, how did first responders like nurses and doctors deal with this spine-chilling disease? Here to discuss is first-year residential physician who wishes to maintain anonymity as it impedes frank expression, especially for younger doctors.
The virus really targeted everyone. It was from, people who had pretty healthy immune systems were also affected. People who had underlying comorbidities, conditions like diabetes, cancer, people who were considered immunocompromised. They were affected more severely because their body already had a low immune response and they couldn't build a strong enough response to COVID. People who had no conditions, like healthy 30-year-olds, a lot of them were so severely impacted that they also were hospitalized, and quite a few of them didn't make it.
For some, the symptoms brought about differential diagnosis.
So the symptoms were very similar to many other viral infections. So it was cough, fatigue, malaise, a lot of GI symptoms, nausea, vomiting, diarrhea, shortness of breath, and the classic loss of smell, loss of taste.
Yes, losing your sense of taste was a popular symptom of whether or not you had COVID-19. So much so that even doctors started using it as a diagnosis. But there was a lot of other symptoms other than losing your taste. Speaking of losing your taste. Oh no! I can't taste my water. Guess I gotta go to urgent care.
Doctors also used vaccines. Ravishing diseases from the plague to the Spanish flu, Ebola, and HIV brought about vaccines. Vaccines are science's greatest development of Western medicine. It takes years to be done. However, with the COVID-19 vaccine, the rapidity at which the vaccine was produced and released to the public was astounding. So how was it done?
mRNA is the key ingredient in vaccines helping us fight COVID-19. But what is mRNA? Here, in the human body, our cells are constantly making proteins to keep everything running smoothly. mRNA, or messenger RNA, is a key part of this process. It carries the instructions, or code, from the DNA to create different proteins in the cells. In a vaccine, mRNA is delivered inside a protective fatty coating, which can get into our cells to release the mRNA code. It instructs the cell to create a spike protein, the same protein you'll find in the COVID-19 virus. The body recognises these new spike proteins as foreign and then learns how to identify and fight the real virus.
The vaccine for many became their saving grace, a light at the end of the tunnel. Eventually, vaccine mandates began to be imposed to protect the most vulnerable and contain the virus.
My administration is now requiring federal workers to be vaccinated. We've also required federal contractors to be vaccinated. If you have a contract with the federal government working for the federal government, you have to be vaccinated. We're requiring active duty military to be vaccinated. We're making sure healthcare workers are vaccinated, because if you seek care at a healthcare facility, you should have the certainty that the people providing that care are protected from COVID and cannot spread it to you.
This sparked opposition, as anti-vaxxers, people who are strongly against getting vaccines, were now on the rise.
We're here because we are against the mandates that the politicians are putting forth for vaccination, for mask wearing, for everything. It's against the Constitution.
Although many were and still are impacted by the physical reactions to COVID-19's infectious powers, the mental effects for many were deemed to be just as long-lasting.
Before COVID, mental health was what I would say was average. It was normal. People were coming in for daily anxiety concerns, depression concerns, life transitions, life adjustments, interpersonal relationship issues, just day-to-day difficulty coping with certain things. We do specialize in trauma, so we were getting our, what I would say, typical trauma work also being addressed. As COVID began to creep up on us, you began to see anxiety increase because people were nervous about one getting COVID, their loved ones getting COVID, and then people dying from COVID that they loved.
Businesses boarded up their walls and closed their doors, and no, they weren't bracing for impact from hurricanes, but a different type of storm approaching. The reign of terror that was COVID-19. Part 3 of this documentary goes into the massive blows this powerful virus had on businesses and how many persevered in the face of destruction for the sole purpose of uplifting communities destroyed from the impact of this pandemic.
It is infecting people, and it is also infecting the economy.
Despite the virus ripping through many businesses, other organizations stayed strong and of necessity grew, like Long Island's first food bank, Long Island Cares.
The market basket has gone up between 12 and 17% in the last 2 years. People are finding it hard because their wages aren't going up at the same rate as the cost of goods. But so we just continue to work together with the communities, find out what they need, and try to make sure that people are supported.
And support was needed, especially for businesses. Even after reopening their doors in 2021, the hold COVID-19 had on stores continued.
People are still fearful of COVID and what it will be like in workplaces and ensuring their own safety.
COVID-19 lured over the heads of many, but there was a business who was putting light into the world at such a dark time, brightening up the faces of bedridden patients and tireless workers like first responders through art.
So what we did was try and create things not only for the patients, but in thanks to the medical personnel, the firemen, the truck drivers, all these people that put their lives on the line.
My name's Lindsay and I work here in the Greater Naples Fire Rescue District, and Splashes of Hope, as well as Paule Schreinermaker, was so nice to donate this lovely mural that we have now inside of our community room here at headquarters in Naples, Florida. So we want to appreciate the appreciation and, continue to push that forward.
The bravery of these people, it just boggles the mind that everybody came together, and it's unfortunately not typical of how people are, but they knew that they had to come together to get us through, and they did. And I think that the artwork helped that tremendously, and it selfishly, it helped us too.
You know what was also helpful? Jobs moving over to remote work. Remote means working from home. And later on, when COVID restrictions were lifted, jobs moved to hybrid work, which is working from home and also working from your designated workplace. But staying amongst this screen for months made you feel like you were stuck in a two-dimensional world, and it often made you feel like this. Get me out of here!
Companies, essentially finding ways, both process-wise, in terms of technology, in terms of all these various structural factors that enable employees to transition to remote work literally overnight, I think was fascinating. And then I think coming out of COVID, it's been fascinating to see how companies have responded. In other words, some companies have essentially kept remote work policies in place or introduced more hybrid approaches.
It wasn't just businesses that began working remotely during the pandemic. Indeed, computer-based visioning and imagery of authority figures became a generational commonality as human-to-human contact slowly vanished and the place many school-age youngsters dread waking up for. Now, what's that box place with the chairs and the desks where we all feel trapped? Oh yeah, schools. They were now shut down due to COVID-19's lockdown as students throughout the country switched to schooling from the comfort of their own home. The idea sounded great at first, but soon led many down a spiral of long-term issues, leaving educators to pick up the pieces. In Part 4, the topic of the ever-so-dreaded school, educators and students navigated this time. Parents' frustration will be discussed and how it has since impacted them 5 years later. According to the National Center for Education Statistics, a federal agency that collects, analyzes, and reports data on education in the U.S., over 7 in 10 schools moved to online learning in early 2020. 77% of public schools and 73% of private schools reported moving some or all classes to online distant learning formats in early 2020. And now, if a teacher's job wasn't hard enough, it just became more difficult.
It was really traumatic Imagine being told that you have 20 minutes to collect any objects you need to be able to instruct 5-year-olds through a video camera, which again, at that time, Zoom wasn't a thing. People did FaceTime, but it was just a very different dynamic. I mean, we had to even just learn how to do a Zoom. Then we had to learn to do live feeds with the kids, like instructing directly. And then we had to learn how to use an app called Seesaw, which is where you design curriculum and it's online, and the kids, there's different tools and things like that to be able to interact with the program and for us to deliver instruction. So that was a very complicated program to learn because you had to do voice clips, you had to do directions, you had to actually design the layout of the worksheets you wanted them to do or whatever the activity was. You had to link the books to it if it was a read aloud. It was hours and hours of work behind the scenes, even though they were only asking us to be on screen with the kids for an hour each day.
Now, what about the parents who not only had to deal with their own dilemma during the pandemic, but now also have to be tasked with making sure their kids are paying attention and are in their virtual classes, something that they weren't responsible for pre-pandemic. This leading many to protest.
We now have a much better sense of what schools look like, and the science shows us that schools are safe.
It was a hard time for everyone, especially high school seniors like myself. The rest of our high school experience was tainted because we had to experience our senior year outside of school walls. But hey, at least my soccer skills weren't.
No one knew what the future of the school year had in store, and while students sat in front of a desk for hours and had piles of work to do with no social interaction in sight, guidance was needed.
I have to say, in the position that I was in, and anybody in the counseling office did have their hands full with certain kids. I'm talking to a 17-year-old kid who's tucking his brother and sister in, and then he gets on the phone just to really cry over it. Like, I can't do this. I'm not supposed to be an adult yet. I'm not supposed to be taking care of, my little siblings like this. And there were some people crying over prom.
The support continued even for the older students because it wasn't just children and adolescents who were finding it difficult to navigate this pandemic during their educational years.
And so a few things that come to mind that we had to manage right away. One was we had a lot of students within SUNY who were studying abroad in Europe. And so because COVID had flared up in Europe, the governor was able to get a flight to get students on a plane back to JFK to make sure they're here in the US. And we became one of the campuses to actually house students right away. So that was a bit of a challenge because, again, there was so much unknown about COVID, how it could be spread. And so there's a lot of fear about bringing people who might be infected with COVID onto Long Island, and they wound up actually being housed at the Southampton campus. But even, for example, something as basic as getting food to individuals, getting a laundry vendor to do students' laundry was challenging at the time.
And although times were tough, we overcame many obstacles by working together. We survived, even having a little bit more appreciation for our education and school staff.
We had to be there for each other, like in a distance kind of way, because we all were too tired to really do anything. We would get up, we would eat and go right back to bed. That's all we had the energy to do. But throughout it all, we tried to have faith, in God, that He would bring us over and He would bring us through, and He did.
5 years later, I would say we're getting back into the normal, or what we call now the new normal, right? There's in-person treatment, but now there's virtual treatment. And I think people are more open to treatment post-COVID because they have such an easy accessibility to it.
Zoom meetings and meetings with a Zoom option, I think, are here to stay. For better or for worse. In some ways they're great, and it enables people to log into a meeting if for whatever reason they can't, be here on campus on person and that they would otherwise miss. So on the one hand, I think it's great. On the other hand, I think we lose something when we don't have in-person interactions.
It taught us all how to be resilient and cope with stress and respond to change. And my view was, if this generation can respond to COVID, they can respond to anything.